sulfur,
Ooh,
rotten
sulfur.
eggs. Rotten eggs.
What happens when you smell that? When you
Rotten eggs.
stop, and you go back.
Stop and run.
Retreat. Yeah, call the people that queued up. It's not self-contained breathing apparatus, SCBA here. Back pain radiates around to the groin.
UTI. Oh,
Kidney stone?
Yeah, kidney.
Kidney stone wraps around, and it's one-sided. I've never had a patient where there's both sides. Left lower quadrant pain,
Diverticulitis. Cholecystitis.
female.
Ovarian type shit.
Ectopic pregnancy.
So there's, how do you know the difference between ectopic and ruptured ectopic?
Ruptured or bleeding.
Shock.
Yeah.
And you don't have to have vaginal bleeding with ectopic. There's bleeding, but it just may not be communicating out. It's just being internal. Okay. Right upper quadrant, pain, radiates to the right scapula.
Cholecystitis.
What organ is that?
Gallbladder.
Hollow, solid?
Hollow.
What else could it be?
Liver.
Liver failure. There's not a question on this yet, but maybe there won't be, but liver failure, what's that guy look like?
Pedalodemia.
Jaundice. Yeah.
What
It's
else?
jaundice.
So yellow skin, starts in the sclera and then just kind of gets global smell.
Is it
I
pedalodemia?
smell.
They're not clean.
Pedalodemia? No, no.
That's kidneys.
Oh.
Good. Yeah, good, good. Extension, what's the medical term for it? Starts with an ASC, ascites. Ascites is like a big, like they look pregnant.
Oh, like a beer belly.
It's
Or
beer
bigger?
belly on steroids.
Oh.
Beer belly on keg belly, yeah. But it looks like, it's usually the patient is malnourished, so they're skinny everywhere else but this big belly. And that's fluid.
I had a patient like that.
Those patients go into congestive heart failure sometimes. Liver failure, jaundice and altered.
But you have liver failure, you just die.
It's like all separate.
Maybe.
You can't live without a liver, if that's what you're saying, that's true. You can get a liver transplant. And yet, funnily, and I only know what I'm about to tell you, no more, but you don't need the whole liver, just even like a third of somebody's liver attached to yours and you can live, or maybe it's not attached, but you can just get away with that. So, I'm an alcoholic. Hi, I'm Dave, I'm an alcoholic. Step one. I've got jaundice, I've got ascites, and I'm altered. What's my problem? That's kidneys.
I said, what?
What's your problem?
Why am I altered?
Low blood sugar.
I've
Because
got
of the
radial
liver.
pulse, and I'm altered.
It's because of the toxins that the liver can't process anymore, so it's out in your bloodstream. Now it goes to you.
Goes to my head. What's the name of the problem? Ammonia is why, high ammonia is why these patients get altered. It's called hepatic, which means liver, encephalitis. Encephalobrainitis. Hepatic encephalitis. They can be completely unresponsive, they can just be taking their clothes off, running around, and shitting outside.
Nice.
See my stepdad. Treatment for it, this is just kind of a fun fact for you guys, so that you never drink another drink in your life. Fun fact, how do you get rid of the ammonia once it's
Potassium
high?
chloride or something like that. Something.
What do you know other than me? When you're to spend the last 6 months not drinking when that's who you've been for 50 years, literally. Anyway, I digress. Don't drink and drive. Spay and neuter your cat. Stay in school. Nitroglycerin dose.
0.3 milligrams.
0.3.
1.3 and 0.4. side effect?
Headache? Nausea?
Nausea, no.
Oh.
Headache, yes. What's the big one though?
Hypotension.
Hypotension is a big
Mhm.
one. So what if your patient got dizzy and passed out after that trip?
Laying
So
down.
what do you do? Lay him down, give him oxygen. What kind of shock is that? Shotgun. Whoosh. No. Missed.
Psychogenic.
Okay. Do another month?
No.
What did you just gave a medication that does what?
Vasodilates.
There you go. What type of shock is it again? Thank you.
What type of distributor?
Which one? SNAP?
Snap? It's not septic, it's not anaphylaxis, it's not psychogenic. So, are you saying that there's another one? Another distributor?
I can't do no
I'm
more,
going
no
to
more other
give you-
shots.
It's kind of a combo between, it's cardiogenic,
Yeah,
because of the drug was, but that's not what it did, it dilates. We give it for the heart to vasodilate the coronary blood vessels, so that more blood and oxygen can go. But it's not site-specific, it's your whole body
Yeah.
dilates.
yeah. I guess so, it makes sense, because distributor shock anyway.
How long does nitro last again? Peaks in how many minutes? Yeah, they'll be back in the game in 3 to 5 minutes. Pressure will come back up. So they still have chest pain, you get another nitro? No. 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 Aspirin dose.
324 milligrams.
61.
Shoot up.
81 milligrams.
Maybe, yeah.
You notice that your first answer is almost always wrong. You come up with it, but it's like, slow down. You put tape on Dylan's mouth. Okay. Right lower quadrant pain, female.
Ovaries.
Ovarian cyst, what else?
Ectopic
Rupture,
pregnancy.
ectopic, lastly, something that starts with appendix.
Appendicitis.
Appendicitis. How do you know the difference?
Rebound tenderness.
Fever, nausea, vomiting usually. And also, it started somewhere, right? That pain with appendix, it usually starts
Mid, umbilical.
airy,
Airy.
around the belly button, and then migrates down. What's minute volume?
How much air goes through the lungs?
It's an equation. Respiratory rate times. Yep. There's no, I'll tell you what's not on the test. Define that equation for blood pressure. Heart rate, stroke volume, systemic, that's not on there.
What?
If, there's a couple fill in the blanks, and I'm gonna tell you what they are, cause I need you to know it, and you're gonna have to look it up, so yeah. Compensated shock. What's that look like? What's it look like? Not what is it, but what, how does the patient present? And then,
Pale.
so those are early signs, right? What are the early signs of compensated shock? That's how I'm reading the question. The next question, what are the late signs and symptoms of shock? Decompensated shock, what does that look
Low
like?
blood pressure.
Whatever you say.
Decompensated?
I'm just saying, it's whatever you want it to be. It's your test. What I'm saying is, look it up. Review compensated and decompensated. There's probably half a dozen shock questions. Here's something that we haven't talked about in a while, if ever. But it comes up on registry, so I added it. When there's something called the lethal triad in trauma, and the lethal triad is, you don't have to remember all of it, but helps focus on one of it. It's hypoxia, so you have a trauma hypothermia. So there's a question that comes up all the time on IV fluids. Paramedics are giving IV fluids to trauma patients. What's the core temperature of somebody? 98.6-ish, 36.5 C. What do you think the temperature of my IV fluid is in the ambulance? It's whatever it is in the ambulance, right? So you take somebody who's in shock and I put cold fluid into them, it's like poison to them. So that's, the question has to do with, what do cool IV fluids do, or IV fluids in general do to a shock patient? Obviously, it's a bad thing, right? So what do we do to mitigate that? So the problem is cold fluid. How do we mitigate that in an ambulance?
Increase the temperature before you get there.
So if you,
But in a little warmer thing,
we don't have warmer thingy, but you're saying it correctly.
Oh, you put it on the dashboard?
Yeah, for the defroster. Yeah, in the wintertime, you always have a liter bag up there that's getting heat from the defrost. If you had a station, we'd nuke it for like 30 seconds and microwave on the way up. I'm not really sure what that does to the plastic, but we didn't care at the time. But some cool ambulances have a warmer cooler inside the rig. Some people heat up their lunch, with those, you'll know the name of it, that little square thingy that you plug in, keeps your food warm. No, it's like a little,
the
it's
lunch
like,
box that comes with the heated.
yeah, it's like a little
Oh,
canvas
Lunchable?
thing that you get them for Costco. If you get on an ambulance, you really want one so you can have cool or warm food when you want, but they'll take an IV bag, fits in there nicely. So heart attack, I already told you, there's OP QRST for a heart attack. So, and that's and you have, it's in your book, just go through it. What about other stuff? Other clinical signs and symptoms of heart attack? It's part of the question. After you do OP QRST, other stuff. What other stuff is a big deal, somebody having a heart attack? It's big.
Allergy.
Like when you look at your patient.
Pale.
Diaphoresis is number one. If you look at statistics, heart attack and diaphoresis, those things go together. You would never want to discount somebody who's diaphoretic with chest pain. What else?
Who did I present that with, John?
Say again. You wouldn't know if it's angina or a heart attack. You know it's cardiac in origin, right? It's one of those acute coronary syndromes. What else other than diaphoresis? You would notice it from a distance walking up. They appear to be
Pale.
Yeah.
Pallor.
We'll go skin signs, so pale, diaphoretic, short of breath, and then dizzy, nausea, vomiting. Dizzy, nausea. Okay. If you just had one of those, if you were to just pick one, which is fine, diaphoresis, it's a big deal. What about thoracic aortic aneurysm? Same question.
Okay.
No.
Ripping.
Other stuff. Oh. Tearing is better. Tearing is better, but your book says sharp/tearing. That's the best answer, sharp tearing. Tearing is what I remember. That's what patients have told me. But just throwing it out there.
Blood pressure.
What about the blood pressure?
Talking about it.
We're talking aneurysm.
Good difference.
On each arm.
Yes. So different blood pressures. Why?
One side's getting less perfusion. The arches, depending on where it is, it can be a different amount of perfusion.
So on your chest pain patients that you were unclear, you want to get blood pressure on both sides. What if the patient had abdominal pain radiating to, I have sudden onset of 10 on a 10, tearing abdominal pain radiating to my back.
Triple A.
Are you gonna check my blood pressures on both arms?
Femoral?
Femoral.
You can check the blood pressure on my femoral.
No.
I would just transfer.
But I would, yeah.
Yeah, you should palpate the femorals and see if there's a difference in quality. For the same reason. Yes. The aorta comes down and it splits into two big arteries. Don't need to know it for the test. What are those big arteries? It starts with iliac. they subdivide to femoral. Okay. Somebody asked me the question today. I can't remember, I'm sorry, I can't remember who, but it was a good question. Even though it's late in the game, I still appreciate it. When do you listen to breath sounds? You asked me. When you take, we'll stick with trauma, but in general, you get breath sounds when you feel like it, when the patient says, I'm short of breath, during the primary, after the primary, or the
When you
secondary.
give them the,
Primary for breathing.
After primary, right?
Say it louder.
After primary?
Yeah. Or during. Because I mean, how many seconds does it take you to do your primary now? So at the end of it, it's weird to do like, okay, the patient's appears to be in X amount of distress, they're not bleeding, the airway is open, the breathing is whatever it is. I'm gonna stop, get this thing out, get hair out of my face, take a look at it. Oh, did I clean this lightly? Put it in my ear, and then have the patient take a few breaths. The whole time, I don't know that they are missing a pulse, in their arm, because their blood pressure's so low. So it's at the end of the primary, so I'm gonna get your breath sounds. Not on the test, but a big deal in life. We're gonna say they're important, right? The breath sounds,
Yeah.
vitally important, especially if we treat them. And the patient's in a seated position, they're kind of slumped over, pale, cool, diaphoretic, no radial, no brachial.
And supine.
But what about the breath sounds? I can hear like rattle in the chest. Is it important to get those breath sounds early? Yeah, lay them down. You don't hold people up that have no blood pressure while you can give. I've done it. It's not good. It's not good for them. Had to learn that one hard way. There's a lot of OB questions, kids. How many? 17, I can't find these. There's a lot. There's at least 10 OB. It's OB and neonatal. So OB could be PID, complications of PID. Could be when to suction the baby, what to do with the umbilical cord, getting an assessment on the gravidipara, that kind of thing on the pregnant lady. Previa, abruption, pulmonary embolism, shock in a pregnant trauma patient. Why are they at delayed shock? Positioning of them. And then that's the mom. Now the baby, remember those steps? Position, warm, dry, stimulate, suction. It's on there. It's not on the body. What patients you put in knee, chest, or hips elevated position?
Prolapse cord.
Or